We are joined today by community member Ron Kantner to talk about his recent experience with an unknown and life-threatening blockage discovered in his heart through CT cardiac calcium score screening. And we're also joined by one of his cardiac doctors, Dr. Miran Arapur, who was essential in getting Ron the care that he needed. So first of all, Ron, I understand that you live a pretty healthy lifestyle by trying to eat right and making time for exercise, but what made you decide to get this screening in the first place that eventually led to your diagnosis?
Well, my nurse practitioner was very persistent, and I would say her wisdom and just kept after me. I was a little reluctant, just for what you're saying. I had no symptoms. I was able to exercise 3 days a week, running, and so I felt like I'm fine. There's no way I have anything going on. But my nurse practitioner was Marilyn Roberts, my primary care provider. She said, I just have this feeling that something's not right. Your blood pressure's been kind of up and down, and she was very on it. She said, look, you've had a stress test, but I'm not crazy about the results. So she kept after me, and so we kind of made a pinky swear. I said, okay, I'll do this new CT calcium test. If it shows anything, I'll go see Dr. Arapur. If it's not bad, then we'll do it my way. No offense towards the cardiologist, but do it my way, and I'll not see anyone.
So, Dr. Arapur, I understand that this screening is used to detect the plaque buildup that can take place in the arteries. Can you tell us what this screening detected and how the next steps for Ron were later determined?
Sure. For the most part, when we are looking to find blockages in the arteries, we can look at patients. I like to divide them into three categories. Those that are asymptomatic and they're just looking to see what their risk is for having coronary artery disease. And the coronary calcium scoring is one of the good tools we have in that setting. Just think of it the same way as you're checking your cholesterol level to see what the levels are. And then if the individual then has high likelihood of having a coronary artery disease or the calcium score come back abnormal, the second test would be something like the stress test, which would assess to see if the heart muscle is getting enough blood flow to it. And ultimately, if that fails to resolve the issue and you still have the suspicion that there is a problem, the ultimate test would be a cardiac catheterization to look at the arteries. So, anytime plaque buildup in the arteries starts to develop, there is a certain degree of a calcium content that goes along with it. So we technically think of it as higher degree of a calcium just means a higher degree of a plaque burden in the arteries. Doesn't always mean that the artery has blockages that requires a cardiac cath, a stent, or a bypass, but nevertheless, it raises the clinical suspicion that the individual has significant blockages. So we correlate the severity of a calcification in the arteries detected by calcium scoring, which is obtained through a CAT scan, with the degree of likelihood of a patient having blockages or atherosclerotic plaques in their arteries. For the most part, less than 100 or 0, closer to 0 is very good. Between 100 to 400 puts you at a moderate to close to a higher risk, and greater than 400, you would be at high risk of having significant plaques in your arteries. Now, there are a subset of patients that are a little overachievers, and like Ron, that they exceed 1,000. And in those individuals, then the clinical suspicion would be pretty high that they do have significant blockages. But nevertheless, still you cannot determine just purely based on the numbers that these individuals require anything. That's why the next step after that would be either to decide clinically if a stress test or a cardiac catheterization would be the way to go.
And Ron, what would you like to share with our viewers rather quickly about this screening process?
You know, it was easy. It's non-invasive, inexpensive, and obviously it's accurate. You know, it predicted I had blockage, and I had a lot of blockage. Probably, in my opinion, the CT calcium test saved my life, because I was a typical male that would have just said, it's just another test. I'm not going to go through that. But I'm very, very glad I did. And, that's what I'd like to tell viewers is, you really should consider the test. It might save your life like it did mine.
And if you would like to have one of these tests done, you can schedule your CT cardiac calcium test with the Lima Memorial Radiology Department by calling the number on your screen. Thank you so much, guys, for your time, and we're back with more right after this.